People always wonder what BMT stands for. It stands for bone marrow transplantation. So the bone marrow is a very large organ that we all have inside the bones, and is the factory that produces your white cells, your red cells, and your platelets. And it's an organ that we can transplant for patients in need. Bone marrow transplantation has been used for 30 or 40 years already for patients with advanced blood disorders. Initially, it was developed for patients with acute leukemia, which is a very serious blood cancer. Close to 5,000 bone marrow transplants per year are done in the United States. So when we start a donor search, first we do HLA typing on the siblings of the patient. Each one has a 25% chance of being a perfect match. Only 25%. And for the size of the American families, which is usually 1 to 2 children, so you will have at best 35% of having a matched donor within the siblings of the patient. So that was a great limitation for bone marrow transplantation for many years until the development of the international bone marrow donor registries. So nowadays in the United States we have a large donor registry with approximately 12 million voluntary donors. And this is connected with many other registries around the world. So at any given time, we're looking for a donor. We're looking into 20 or 25 million voluntary donors around the world. The most important factor when we look for a donor is HLA matching. HLA stands for human leukocyte antigens, which essentially are just markers in the surface of the cells. So we test for 10 markers, nowadays up to 12 markers, and we want the donor to be HLA identical with the patient. Now, this is critical for the success of the transplant because otherwise there will be graft versus host and host versus graft reactions, like immunological battles that will threaten the success of the transplant. So to become a bone marrow donor is very simple. You go to the website for beatthematch.com and the instructions are there. You will register your name and they will send you a kit to your house. The kit has a couple of swabs that you take out, and you take out swabs from your cheek, you put it back, and you send it, and it's done. If you are selected as a donor, you're gonna get a phone call, and they're gonna say, we need you. And then they're gonna set up dates for you, what is convenient for you, but also convenient for the patient, because some of these transplants are relatively urgent, so they will try to set up a time for you. And then you're gonna go to a transplant center. In this case, you could come here to Mayo Clinic, for example, if you are local. And then you're gonna have a medical evaluation. So just a history, physical, some blood tests, just to make sure you are a healthy donor. And then you will be cleared for the donation. So the biggest challenge that we have to find donors for our patients to proceed with bone marrow transplantation is ethnicity. It remains ethnic background because we will find a donor in the family only 20-25% of the time. And if the patient belongs to an ethnic minority, we're going to find a donor in the registry in only about 20 or 25% of the time. So for many years, we had a number of patients for which we had to use suboptimal donors that are not perfectly matched, that increases the risk of the transplant, or we would not find a donor at all, and then these patients would never have a transplant. The more donors we have in the registry, the more donors we will have for our patients. And this is critical for ethnic minorities. It remains critical. That's one thing. The second thing, every now and then we have a patient that doesn't have any siblings and never had children. So that patient, the only source of donor for that patient is the donor registry. So it happens. It's not uncommon. So at this point, I would say that it's extremely important to continue having a bigger number of donors in the registry, in particular donors from ethnic minorities.